Thanks, Niels. Thanks everybody who's come in. I can't see you all, but thank you for joining, and thank you, Niels, for inviting me. And also, I just want to thank Kim for all the work she's done in organising this. So I was actually meant to physically be there, and I'm meant to be in Europe right now on my sabbatical, but I'm currently, the reason why I've got this CGI screen behind me is I'm currently in a caravan on 54 hectares about an hour north of Melbourne. So we thought this screen looked a bit more professional than where I'm actually staying right now. So thank you all. Just a bit of a background on this paper. I've actually been working on this paper for far longer than I'll care to tell you. It's been quite a few years, and so this is a good opportunity, I guess, for me to progress the paper. So please, if you do have any feedback or thoughts, this paper is still very much in progress. And so that's partly why we selected to present this paper today, was to give the opportunity to sort of get a lot of feedback on this. And I just want to give a quick shout out to my co-authors. I'm co-authoring this paper with Murray Yerkes from Utrecht University, Mandy Cookland, who's at La Trobe in Australia, and Lyndall Strasdens, who's at Australian National University in Australia as well. So this project, or this paper, actually comes out of a project that we all worked on together some years ago. And the project was a follow-on from the paid parental leave evaluation that was conducted in Australia between about 2012 and 2015. And then we got extra funding to actually extend that project by a few years, and that's what the data we're presenting on, or that I'm presenting on today. So basically what we're looking at with this paper is time pressure and mothers' health and wellbeing, and our focus is on mothers post-paid parental leave. So we got funding to collect annual data on mothers until their children went to preschool, until their children were 4 years old in Australia. So that's the data, and that's a bit of a background to this project and why I'm working with everyone on the team. Okay, so I'm just getting my technology right. I've just clicked on meeting participants. There we go. Now my slides changed. Okay, did that change, Neil? Yeah, okay, good. Okay, so what we wanted to look at with this paper is the issues around time and time pressure. And this is actually something that Lyndall has been working on for a very long time, and also particularly the influence of time and time pressure on health and wellbeing. I myself have actually looked a lot at gender inequalities in time and household divisions of labour as well. So that's part of the reason why we wanted to have a look at this issue. So basically, from our research and other people's research, we know that time is a scarce resource, particularly for working families with young children. We know that work and family obligations each require large amounts of time and energy, and require lots of amount of time and energy from households and the people within them. So basically, paid employment, housework and childcare are all demanding. So time scarcity has become a sort of a common or social phenomenon, and it reflects the feeling of just simply not having time to get everything done, basically. And it's often assessed by the experience of time pressure. So in surveys and other big surveys and other research, it's assessed by the experience of time pressure. So there's evidence as well that feelings of time pressure have also been increasing over the last few decades. And it's largely blamed on this increase of women in the workforce, increase in dual income households, women working, et cetera, et cetera. We also find, well, in our literature review, we also found that time pressure is gendered as well. So both men and women do feel time pressure, but women often feel more time pressured than men. So in these surveys where they look at gender differences, then basically women often have stronger feelings of time pressure than men. I just want to shout out and or note that there's this kind of sideline of literature as well, or a parallel body of literature that actually questions the issue of time pressure and whether it is such a big issue in society. You know, there's sort of these arguments that it's not experienced by everyone. You know, it's sort of seen as a working middle class kind of issue where everyone's being aspirational and trying to live the best life they can, and maybe it's not a problem for the whole of society, but just a few select people or a few select groups of people in society. So I guess in a way it's not totally relevant to this paper, because even if it is only experienced by a few groups of people, the groups of people we're looking at in this paper are actually those who are most likely, these are working mums, they're most likely to be experiencing time pressure. But I just wanted to note that there is this kind of like counter argument, or, you know, it's not 100% consensus that time pressure is as big an issue as we're making it out to be, I guess you could say. So time pressure and health, prior research. So what do we know about the sort of connections between time pressure and health? When we first started this paper, we were actually quite surprised that there's a relatively small body of research on time pressure and health. There is a lot of research on work to family conflict or family to work conflict and health, but not so much on the time pressure that might result from work and family conflict. So again, this is kind of a new area for us. If anyone knows of any other literature that we haven't covered or that we've missed in this paper, please send me an email or interrupt or just write it down on the chat screen for Niels as well, because we've had an RA doing some quite extensive literature searches, and when we actually drill down, we're actually finding we haven't found a lot of research and looking directly at this at the associations between time pressure and health. So if there's anything I've missed, just give us a shout out and we can go and find that research as well. Okay, so basically of the research that we have found, feelings of time pressure or time strain, and they're often measured in very different ways across studies as well. So there's definitely no consistent way to actually measure or operationalize time pressure or time strain. But what we find, irrespective of how they're measured, is that basically they're negatively associated with a whole range of different health outcomes. So there's a handful of studies that have looked at mental health. Time pressure is negatively associated with mental health, life satisfaction, and health behaviours. So there's been a few studies which have looked at things like time pressure and lack of physical activity, and time pressure and the lack of time to basically cook meals and eat well, which we all probably can relate to. We haven't actually found anything that has looked at physical health outcomes per se, just the health behaviours. And the literature, a lot of this literature actually looks at gender as well, and there is evidence that time pressure is gendered, that both men and women experience time pressure, and they experience time pressure that impacts on their health. However, when the negative effects of time pressure are more often experienced by women than men. So I just need to point out that even though a lot of the previous literature looks at gender differences, in this study we basically are restricted to only looking at women. So because we used the paid parental leave evaluation, which was basically taken by 98% of women. 98% of women took paid parental leave. We're basically restricted to looking at women only in this study, even though gender differences have been found. Okay, so to explain the negative association between time pressure and health, most of the existing literature has viewed time pressure as a stressor that is associated with health, and they draw mainly on theories like role strain or stress, multiple burden theories, and the stress process models. So basically what they're arguing is that time pressure is a result of the roles that people have, the number of those roles, the number of things that they have to do in a day, and also often the quality of those roles. So what's expected of you in those roles, whether you enjoy those roles, those sort of things as well. So, and then basically around that, you're sort of arguing that the locations, the structures, the context that you find yourself in also partly determine whether time pressure, you experience the stressor of time pressure as a result of all of your multiple roles or the roles that you have. Within this literature, there's a distinction between time pressure as a chronic stressor or an acute stressor. So a chronic stressor is something that happens day after day, repeated tasks, repeated obligations, repeated responsibilities. Acute is something that might just be, you might acutely feel time pressure for an afternoon or at certain points of the day, but it's not chronic. So most of the literature that's already out there basically conceptualizes time pressure as a chronic stressor, especially when it's being related to health. The other thing that these papers do is they conceptualize the relationship between time pressure and health as unidirectional. And what I mean by that is that it's only ever being conceptualized as time pressure impacts on your health rather than the opposite way. And so one of the things that we, particularly Lyndall and Mandy, really wanted to do with this paper was to see if there were reciprocal relationships or associations between time pressure and health. And so we're drawing on the conservation of resources theory by Hobful, and they theorize, as part of that theory, there's this notion of loss spirals. And so within Hobful's theory, we basically have a series of, we all have resources, and what we want to do is we want to keep those resources and maintain them. And when we get stressed is when we are at risk of losing those resources. So when we experience or perceive that we're going to lose a resource, so for example, in our paper, a resource would be time, okay? So once you start to experience time pressure, you could argue that you have lost that resource of feeling like you have enough time to do everything you want to do, okay? So then when you're experiencing time pressure, that may mean other resources, like your mental and physical health in this case, are then drawn on to cope with that time pressure. But if there's no gain, i.e. your time pressure doesn't relieve, then basically what the argument is by Hobful is that you get into this loss spiral where the time pressure depletes your mental and physical health, and then the depletion of your mental and physical health then makes you less able to cope with the time demands. So you have a sort of loss, what they call a loss spiral. I'm just closing down my emails because I just got an email. So I'm just shutting that down. It came across my screen and covered off my presentation. So what Hobful does is, so basically we're not discounting the theories, the previous theories or the previous perspectives, but what we're doing in a way is just adding another dimension to that, which introduces the possibility that the associations between time pressure and health and well-being could be reciprocal or bidirectional. So that's one of the other main things that we wanted to test with this paper as well. I'm just changing. Okay, so in summary, the limitations of the current research, or the gaps that we think we might fill in the current research, is, well, first of all, there isn't a lot of research that actually looks at this time pressure and health association. The majority of it, all but one study, were cross-sectional, so therefore they're not capturing change over time in the associations between mothers' perceptions of time pressure and health. And also, while the other studies examine the relationship between time pressure and health and well-being, none of them, because they're not longitudinal, they're not able to look at reciprocal effects that might be suggested by the loss spiral theory. So most studies assess the perceptions of time pressure and the health and well-being association, but we want to test the possibility that maybe health and well-being also may then influence perceptions of time pressure and the ability to cope. And basically we're arguing that it's important to look at these things because, you know, women's lives are not static, our lives are not static. Capturing the dynamics of change provides insights into the issues. And also, I guess we have, so previous work that both Lyndall and Mandy have done finds that there are strong reciprocal associations in work-to-family conflict and health and well-being. And so I guess looking at time pressure, which is a result of those conflicts, gives us just an additional insight into how these processes work and how they might impact on mothers' health as well. So we thought it was important to look at these things. So as I explained earlier, this study uses 5 waves of a panel study of women who were working before the birth of their babies. So this is drawing on paid parental leave evaluation. And what we did, the ways that we think we're building on the previous literature is we are going to examine change in the association between time pressure and mental health and physical health over time. So we're adding physical health to the dimension, or I guess as an outcome as well, which we hadn't found any previous studies that had looked at physical health. We're also going to look at whether there are reciprocal effects between time pressure and mental and physical health. And the other thing we're doing as well in our model is we're trying to identify which time demands on mothers, whether they're in paid employment, the amount of time they spend in housework and the amount of time they spend in childcare. We're actually going to have a look at which of those are most important for increasing their time pressure within the context of health as well. And hopefully that'll all become a little bit more clear as I go through the methods and the models. So that's what this study does. So the data and analytics samples, so we called the project Millennium Mums because they were all sort of they was working and had taken paid parental leave sort of in the early millennium. It's a 5-wave panel study of Australian mothers, and they were all working before the birth of their baby. Their babies were born in October and November 2011. So the first wave of the data was actually collected in June, July 2012, when their babies were 6 to 8 months old. So we don't have any pre-birth data. So that is one limitation of the study. But we do have a lot of mums. So basically, we had over 4,200 mums, and the response rate for that first wave was around 73.5%. Then we collected the other waves, between waves 2 to 5, were basically collected annually. So the second data wave was actually collected only about 6 months after the first one. And we did the data collections in December to January every year until the babies were aged 4. So basically we've got 6 to 8 months, 1 year, 2, 3 years and 4 years of age. And we had pretty good wave-on-wave retention rates at that time, especially given that this is basically a sample of working mothers with young babies. So we still had, by wave 5, just over 2,000 mums participating. For the purposes of this analysis, though, we use an unbalanced panels, basically, so we're using observations when they're available. We did have some missing data on dependent variables and some of the covariates, so we've excluded those. But our final analytic sample is around 3,878 of the mothers, and we have an average of 3.4 waves of data for each of those mothers. Okay, so the measures that we've got in the models at the moment, or that we're including at the moment. So the dependent health variables come from the SF12, which is basically a 12-item. It's derived from the SF36, and it's a 12-item scale instead of a 36-item scale. We had to use that because we were limited in the time that we had to conduct the survey. So, but we still get a mental component score from that, which ranges from 0 to 100. And we get a physical component score from that, which ranges from also 0 to 100. So those are the 2 health measures that we've got for this study. Then the perceptions of time pressure measure, this has been used in 2 or 3 of those other studies. And it's actually often used as a dependent variable in studies looking at what causes time pressure as well. There's lots of studies that look at the determinants of time pressure. And so it's that classic, how often do you feel rushed or pressed for time, from never all the way up to almost always. And we actually treat that as a continuous measure in the model, but I'm also open to any other suggestions for so how do you treat that in the models as well? We have controls at pretty much at every wave. So we've got age, relationship status, and that basically includes whether they're married, cohabiting, or whether they're not living with a partner. So some of them have a partner, but they're just not living with them, and some of them are single. So in that last group, but there's too few of them, we had to collapse the groups together. Education is also in there, and also whether there are other children in the household. Now, keeping in mind that this is a 5-wave panel, and so about 700 of these mums had another child during this panel study as well. So, but we don't ask detailed questions about that other child. So basically what we've had to do is have the number of children in the household as a time varying covariate, so you can factor in the birth of another child in the models. And then, as I said, we're also interested not just in sort of controlling for certain things, but we're also interested in what are within the context of these models and within the health context, what are the factors or what are the demands on mothers' time that most influence their feelings of time pressure. So what's most likely to increase their feelings of time pressure? So for that, we've got the number of hours they spend in housework, the number of hours they spend in childcare each week, and we've also got a measure of employment status. So rather than putting in hours worked each week, because we had a lot of zeros in the first couple of waves, of course, because the babies are only 6 to 8 months old or about 12 months old, and a lot of women weren't back at work at the first wave. So what we did was we basically came up with a group of categories that kind of captures a more refined, I guess, employment hours, as instead of just saying it whether you're employed part-time or full-time, it catches a more refined sort of breakdown of the number of hours the mothers are working. We've also included another category in there. As I said, there was quite a few hundred mothers who had another baby and went on leave for another child, and also quite a lot of mothers in Australia don't go back to work after the birth of their child as well, because they basically decide to stay at home, especially after the birth of the second child. So we've just kept we use the categories rather than a continuous measure of paid employment hours. And then the other thing we wanted to do was also get a sense of if the mothers are partnered or if they're living with their partner, what contributions the partner makes in terms of time to work, housework and childcare within the household, to see if those actually also are associated with mothers' perceptions of time pressure. So that's pretty much the measures that we've got in the models. So our analytic strategy was to use cross-slag structural equation models. Now, this is actually my first time working with structural equation models. So again, I'm very open to any advice or suggestions if anyone's got any about anything you'd add, or any other tests or any other sort of any aspects of the analysis that I've missed or that I should really think about or look into. We ran a baseline model for the purposes of this paper right now. We've just run a baseline model, and then we've pretty much just run a full model. I'm not presenting the results of the baseline model because we did do some tests of goodness of fit, and basically the baseline model wasn't a good fit, and this second model is a much better fit. So the first model, as I said, is just a baseline, which is just looking at time pressure and mental health, and then the reciprocal effects of mental health on time pressure. The second model is looking at time pressure and mental health and time pressure, but controlling basically, or looking at the influence of employment status, housework hours and childcare hours on time pressure. And the other model is basically doing the same, but looking at the physical component score. That's what MCS and PCS on this slide are, the medical component score and the physical component score, and TP is time pressure. So basically we're conducting these models to try and, the cross-lag models, to try and get at the reciprocal association. So the way that they're run is that it's time pressure at the previous time modelling mental health at the next wave, next time collection, and vice versa. So looking at mental health, say for example, in the previous wave and how that impacts on time pressure at the next wave, and trying to just sort of capture whether so it's a lagged effect, but it's also trying to catch reciprocal associations. All the models include the controls for age and education and other things that I mentioned before. After running the models with completely unconstrained coefficients, we decided in the end to basically constrain all of the coefficients, because remember they're all time varying, except for the cross lag effects. So we've kept those ones. Basically the time pressure and the health variables are not constrained, but the other variables are. So basically what that means is across all the different models, we get the same coefficient. It averages the coefficient out over the models. The second model as well, for time pressure, in the second model, the time pressure model, we also include the controls or the variables for partners' work hours, housework and childcare hours, even though we're mostly focused on the mothers. And then at each wave, we've also correlated the error terms between time pressure and the health variables, basically to account for any correlation between unmeasured factors. So this is something that I was advised to do by somebody who knows a lot more about structural equation modelling than I do. So again, I'm completely open to any feedback on the models. In fact, it would be appreciated. So that's the analytic strategy. Okay, so just having a quick look at what are essentially the dependent variables and the key independent variables. This is basically just the marginal mean scores of the MCS and the PCS over the 5 waves, and also time pressure over the 5 waves. So you can kind of see that they change quite dramatically. You'll have a look, the physical component score is the bottom one there, and it declines over time. So basically, I think I've got this thing right in front of my screen here. And then I'm just trying to see. So the PCS is, so you can see, sorry, the PCS is the top one. So basically what you can see is there's a decline in physical health over the first couple of years, but then it sort of levels off and increases slightly. But there's a pretty consistent decline in mental health, and there's a pretty consistent increase in time pressure over the 5 waves as well. So basically, our measures do change over time. There is evidence that there's change over time in these measures. Okay, so now straight to the structural equation models, because I wanted to spend a little bit of time. I've actually explained this in the past by saying it looks like a spaghetti monster has vomited on the slide. And so it's quite complex, and I want to take a little bit of time to go through this. And I'm not even sure if you can see can you see my arrow if I'm on the, you probably can't, okay. All right, well, I'll go through it slowly then. So basically, this first slide looks at the associations between time pressure and mental health. What we wanted to do was basically have a look at whether or not the relationship between time pressure at a certain time and mental health changed over time, changed over the 5 waves, whether it increased or decreased. And also we wanted to have a look at whether there was reciprocal associations, so between does mental health impact on time pressure. So basically the part of the model that we're most interested in really is these associations that I've just highlighted in red now. So basically what this is saying is that there is a significant negative effect or association between time pressure and mental health. It's quite large. So that's the top set figures there, or coefficients, and it's pretty consistent over the whole time period as well. So there is some slight hint that maybe the time pressure to mental health effect is stronger in that the wave 1 to wave 2 association, but I'm not putting a lot of stock in that because there's only 6 months time gap in that wave, between those 2 waves, whereas with the other 3 waves or 4 waves, there's a 1-year time gap. So there's a 12-month lag. So maybe it might be to do with the time frame. So even though it's the coefficient slightly larger, and we've tested for the size of that coefficient as well, and it is significantly larger than the time 2 and time 4 to 5 coefficients. We're basically, we're not putting too much stock in that because we feel like it might just be because there was it was only a 6-month time gap between that. The other thing to note is obviously that there is a significant negative effect or negative association between mental health and time pressure as well. So this we take as an indication that there are reciprocal effects between the two sort of conditions. So if you have, basically what that's saying is, if you have better mental health, that you have lower levels of time pressure, or conversely, if you have poorer mental health, you would experience higher levels of time pressure. The other tests we've done on these models is to see whether one association is stronger. So is one pathway, the time pressure to mental health, stronger in its association than the mental health to time pressure pathway as well? And what we found is there's no significant differences between them. Basically, they have equal effects on, they both have similar effects in the models over time as well. So basically what we're finding is that there are consistent reciprocal effects that are equally as strong across both directions, I guess you could say, the time pressure to mental health and the mental health to time pressure over that time. So I think I'll leave that at that. If anyone has any questions about these, we can always come back to them anyway. So that's fine. And then the next slide is with the physical health. So I think the thing to note here with the physical health, first of all, is again, these are the associations we were most interested in, the reciprocal associations, and they're not as strong and they're not as significant as they are for the mental health associations. The other thing to note is that the reciprocal effects, or the effects between physical health and time pressure, actually don't kick in until the kids are about 3 years of age. And we're going to look into this maybe a little bit more. This is also when most mothers are back at work. So we're just wondering if that's kind of a kick point. I don't know, but also recall back in the slide with the descriptives, it's also the time when mothers' physical health starts to improve as well. So there could be a couple of things going on there. We just need to investigate that a little bit more. Again, so with these associations, with the physical health association, the time pressure to physical health association is stronger and more significant than the physical health to time pressure. Sorry, the time pressure to physical health association is stronger than the physical health to time pressure. So the reciprocal effects in this model aren't as strong, and they're just not as consistent for the physical health. The last thing, I'm just mindful of the time because I'm almost at my 40 minutes. The last thing I wanted to quickly go over as well is we wanted to model what were the factors, or take into account the factors that are most associated with, or that are associated with mothers' feelings of time pressure as well in this context. So essentially, in terms of employment status, what we found was only mothers who are employed full-time. So, or basically mothers who are employed full-time feel the most time pressure mothers employed even longer part-time hours or shorter part-time hours, or those who are on leave or not in the labour force feel significantly less time pressure than mothers who are employed full-time. No surprises there. Hours per week in housework, so the more time that women spend in housework each week is also positively associated with their time pressure. Interestingly, the hours a week they spend in childcare is not, it doesn't significantly increase or decrease their time pressure or their feelings of time pressure at all. I put this in because I thought it was quite interesting. Partners' housework hours, so the time that their partner spends doing housework, basically reduces their time, the perceptions of time pressure, and it reduces it almost to the same extent that it increases for women who spend more time doing housework as well. So we thought that was quite interesting. So partners do make a difference only in terms of the housework they do. It doesn't matter about their work hours, and it doesn't matter about the amount of time they spend doing childcare, in these models anyway. So that's the factors. So that's just the summary there. And then, so basically in summary, what we found with the paper is that we feel like we are finding some strong evidence of a reciprocal association between time pressure and mental health. There's a weaker reciprocal association with physical health as well. And there's no evidence to suggest one pathway is stronger for the mental health stuff. That's not actually right for the physical health. For the physical health, time pressure has a much bigger impact on physical health and vice versa. So basically, as I just said, the mental health, it's far more consistent. The associations are far more consistent for mental health and physical health. In waves 3 and 4, we find that physical health improves, but the time pressure and physical health association actually becomes significant at that point in time as well when we look at the structural equation models. So maybe it suggests that mothers experiencing time pressure at that time also begin to have significantly poorer health. I don't know. Again, this is something we need to look into a little bit more. And we do find suggestive evidence, as I said, that the first year after birth may be strongest for the time pressure mental health association. But again, there was only a 6-month time gap in that data collection. And then mothers' feelings of time pressure, what are the factors that influence that? Again, caring. So basically, we're finding that time spent in childcare doesn't actually increase time pressure for mothers. And we feel like this is actually pretty consistent with those qual studies about intensive parenting and the expectations around motherhood and expectations of being a good mother. So if you're spending more time doing childcare, you're actually not feeling time pressure or stress because you're probably doing what you feel like you should be doing at that point in time. And conversely, housework and employment take away from mothers' time with their children, especially when their kids are young and preschoolers, and basically then increased perceptions of time pressure. And again, as I said just previously, partners' time in housework basically alleviates some of that time pressure that mothers are experiencing. And then again, we're just trying to think through some of the policy implications of this. So Australia's not too unlike the UK, but we have a very strong policy focus on getting women back into work and before their child, or by the time their child is about aged 1, and preferably back into full-time work as well. And the implications is kind of that caring for children gets easier, right? Once that intensive infancy child rearing period is over. But our results sort of suggest that it doesn't get easier, that basically time pressure experienced by mothers and the impact on their mental and physical health doesn't diminish over time. It doesn't change much during their children's preschool years. And we also find that the time pressure and poorer health are actually mutually reinforcing for the most part as well, which basically supports that other research out there that finds that time pressure on mothers doesn't reduce as children get older. It actually, in some cases, it gets worse. So basically, you know, our argument would be that the policy supports basically need to extend beyond that first 12 months, especially in terms of paid parental leave and other things in Australia, which kind of really cut out after that first 12 months. And I think I'll leave it there, so I've got enough time for everyone to give me feedback. So thanks, Niels. I put the acknowledgements up.